Excision of the distal clavicle is a common operation, usually done in conjunction with an arthroscopic subacromial decompression. In this case, the AC joint is well visualized and soft tissue is removed utilizing any commercially available ablation tool. An anterior portal is then made such that the instrument can be coplanar with the AC joint. This allows superior resection of the AC joint once the inferior one half has been removed. At this time, the arthroscope is kept in the posterior portal and a burr is placed through the lateral portal and the inferior one half of the distal clavicle excised. This is penetrated to a known depth. The arthroscope is then changed to the lateral portal and the anterior portal is then used for resection of the superior one half of the distal clavicle. Sequential burring is important to avoid gouging and leaving remnants of bone. In particular, the posterior superior AC joint must be addressed. Once a satisfactory resection has been completed to a known depth, a 7-degree arthroscope is introduced via the posterior portal and the degree of resection can be easily assessed. In this case, satisfactory bone resection has been removed in a parallel fashion, and this can be measured with a mixture clamp which is introduced via the anterior portal, and this clamp is then used to determine the width of bone resection, which should be approximately 10 millimeters. By placing some marks on the outside of the clamp, the amount of bone resection can be easily judged as noted on the video. Once an adequate resection has been confirmed, the AC joint is touched up and the end of the distal clavicle should have a kidney bean appearance showing a satisfactory resection.